Understanding arterial blood gas results starts with mastering the normal range for carbon dioxide in the blood. When patients present with respiratory distress, these numbers reveal the overall efficiency of ventilation. Knowing the baseline is crucial for identifying critical imbalances before they become life-threatening.
The normal PaCO₂ range is strictly maintained between 35 and 45 millimeters of mercury. Levels below 35 indicate hyperventilation, where too much carbon dioxide is blown off by the lungs. Conversely, levels above 45 signify hypoventilation, meaning the body is retaining too much CO2 due to poor gas exchange.
Nurses must monitor these trends to intervene before respiratory failure occurs or acid-base balance is compromised. By staying within the 35 to 45 safe zone, you ensure optimal oxygenation and cellular function. Always correlate these laboratory values with your patient's clinical symptoms for accurate assessment.